Good evening, everyone, and welcome to this AOGME forum hosted by the AOGME Residents and Fellows Council, or the RFC. This session will educate residents on moonlighting policies, provide a general understanding and guidance for moonlighting during and after residency. My name is Dr. Bree Howerton, and I'm a PGY1 emergency medicine resident at Corewell Health. I am a member of the RFC Policy Committee, and I will be facilitating today's session. Before we get started, I'd like to review a few housekeeping notes. This webinar is being recorded, and the recording will be posted to the AOGME website within 7 days. All webinar participants are in listen-only mode. If you experience technical difficulties during the webinar, please use the chat feature and we will assist you. If you have questions for our panelists during the webinar, please feel free to submit them through the Q&A feature at any time. If time permits at the end of the webinar, our panelists will respond to your questions. The speakers for this educational activity do not have any relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. I will now have our other panelist, Susan Sanford, introduce herself.
Hello, I'm Susan Sanford. I have kind of a diverse background. As you can see from my bio there, I have my law degree, but I found my way into this space in a very different way. Always dreamed of being a prosecuting attorney and worked at a hospital all while going to law school. And while going to law school, I quickly discovered, probably about my second semester, that I didn't want to be a prosecutor. So I thought, what am I going to do? So I kind of trudged along all the way through law school, and all while working at a hospital in the medical records department, back when there were paper charts. And right prior to graduation, the CEO of the hospital came to me and asked me, Susan, what are you going to do? And I said, I don't know, but I'm not going to be a prosecutor. So he kind of persuaded me to get into this space. So back in 1994, when I graduated from law school, I started working for this hospital, and I did everything from helping them do a medical staff development plan to try to figure out how many physicians they needed and what specialties. I helped them come up with recruitment strategies of how to find them. I helped them find them. And I actually found my space into physician contracts because the hospital then wasn't employing a lot of physicians. Most physicians were in private practice. So they didn't know how to compensate physicians. They didn't know how to write a contract. So I kind of helped them into that space. That was 1994. Fast forward 30 years, I'm still here in the industry, have done a variety of things, have worked for a number of hospitals, and for nearly 18 years was self-employed and did a lot of resident education on how to transition into practice. So I'm not a GME expert. I'm not an immigration expert. I am a contract expert, but have really dove into everything related to employing physicians. So moonlighting is something I'm certainly versed in speaking to, especially from an employer side. So happy to be here tonight. Put together some slides to walk through, tried to address many of the questions that many of you posed ahead of time, but as Dr. Howerton said, I'm happy to take questions throughout the presentation or at the end too. So should I dive right in? Okay, awesome.
Yep.
So I was thinking of the topic of the presentation, and I didn't name the presentation, but they called it the Resident Moonlighter Primer. When I think about primer means, it means to prepare, right? If you're priming a room to paint, you're kind of preparing it to paint. So today's webinar is not to give you every last detail, but it's kind of to prime your mind into thinking, what is moonlighting? What do I have to look for? What do I have to watch for? And how can I get into this space? So when I put together these few slides, and the slides are really meant to be a guide to go with the verbal presentation that I have for you, but it's really not meant to be the end all be all, but it's really to start getting you thinking about, do I want to do this? How is the right way to do it? And making sure that you don't get yourself in trouble later. And I love to tell stories, so I'm sure I'll have some stories to tell along the way as well. So to me, when I think about moonlighting, when I think about any topic like this, you really have to take a step back and you have to talk about the basics first. Okay. So when we think about moonlighting, I think the very first thing that you need to understand is what type of licensure do you need before you can even consider moonlighting? So as a resident or as a fellow, you have a limited educational license. So the first thing you need to look at is what are your state's rules in regard to licensure? Okay. Next thing, we're going to go into a little bit of detail on these things. Next thing you have to say is, hey, what does the Council of Graduate Medical Education say about moonlighting? What does ECFMG say if you're an international medical graduate on a visa? What does the employer or where you're going to moonlight, what are their medical staff bylaws? What do they require? What do they restrict? And the last thing you really need to look at from a regulatory consideration is CMS and payers. Okay, so I kind of want to walk through each of these and tell you the types of things that you need to understand and need to be considering. So first of all, state licensure, I think is pretty simple, right? Look at the state you're in and find out what are the licensure requirements in order to get a permanent full physician license to practice, because that's what you will need to practice medicine in that state. I live in Michigan. In Michigan, as a DO, you can get a permanent physician license after 1 year of training. An MD has to be 2 years of training. Not every state has that same rule though. So what you need to say is at what point can I apply for and get my permanent license? Okay. ACGME, what are their requirements? So ACGME has some very strict requirements of trainees in saying what are they allowed to do and what do the institutions have to do. Okay, so nowhere does the ACGME say that you have to require someone to engage in moonlighting. They do allow you to prohibit it. So there might be some institutions, training institutions, that say no moonlighting. Okay. Some institutions have an institutional policy that says you can moonlight, but then they leave it up to the discretion of your individual program. So if you're working in an institution that has multiple training programs, it's not the same rule for each of them because some programs may allow it, some may prohibit it. Okay. Ultimately, though, what you have to do is if you want to moonlight, you have to disclose it and you have to get it approved. Okay. And it's funny, I was preparing for this. I was out Googling some things and I came across a Reddit page. I don't read Reddit very often, but I read some Reddit comments today and I thought they were very interesting as to like, hey, no one ever tracks it. Don't worry about it. Hey, they can't stop you from earning money, or hey, that's BS. Don't let them do it. It's kind of serious, so I would follow the rules. Okay. You've gone too far to, in my opinion, jeopardize getting in trouble. So if you want to moonlight, to me, your very first step is to talk to your program, dive into your institutions and in your program policy to see if they allow it and really get to know what restrictions they may have, because they do look at it, they do monitor it, they do log it so they can stay in compliance. Okay. One institution, again, in doing my homework, I talked to a few GME programs just to say, hey, how do you do this? They have you submit logs because they still have to comply with the 80-hour rule, even with your moonlighting. And one GME program shared with me, they were looking at logs, and this one resident was continually doing 30 hours of moonlighting every single week. So they do pay attention to those. So disclose it. The other thing I want to tell you as an employer, because after nearly 18 years of being self-employed, I recently became employed by a health system, and we ask. So we do accept moonlighters at Pine Rest where I work now, but we ask to speak to your program director so that we know that you have the approval. So don't skip over those steps. They're very, very important. Okay. And don't get your nose out of joint if your program says it's not allowed, because ACGME says that they have the discretion to do that. Okay. What else do they say? We have to look at the overarching purpose of all these rules, right? While you're going through training, your priority is your training program. So some of these restrictions and some of these rules are really put in place to make sure that you're upholding your end of the deal, and what you want to do on the outside isn't interfering or isn't prohibiting you from doing what you need to do as a trainee. Okay. And as I said, they do need to be tracked. Last bullet I put on this slide is someone asked a question about this, so I thought I would just highlight PGY1 residents are not permitted to moonlight. It says right in the ACGME institutional requirements. Okay. So we've talked about state licensure. You need to look at the state license that you're going for. We've looked at the ACGME rules. I just want to mention ECFMG because someone asked a question about international medical graduates. So there's no hard and fast rule about international medical graduates. What it really hinges on is your visa status. So if you're an international medical graduate, but you're a permanent resident or a US citizen, then you're fine. If you're at a J1, ECFMG strictly prohibits moonlighting. You're on a training visa, they don't allow it. If you are on an H-1B, unfortunately, the H-1B is employer specific. So you are an H-1B for the institution that you're training at. If you wanted to moonlight, you'd actually have to get another H-1B for that employer. Okay. Now, the next thing you need to consider, if you've made it through all this and you're like, hey, I'm clear, it's looking like I can moonlight. If you're looking at specific opportunities, you need to say, does that organization where I want to work have any bylaw requirements or restrictions? Okay. You're narrowing the funnel. First, you took the broad scape. Hey, I can get a state license. Hey, I know I'm in compliance with AC GME rules. Hey, I know that I'm not doing anything in violation of my visa or my immigration status. Now you're drilling down to the specific employer and saying, is there anything that they require? Again, the hospital that I'm working with right now, when they took on moonlighters, they had to go back and revise some of their bylaws to say that they're willing to take them. Okay. And the last consideration is really not something you have to be too concerned about, but it is something you should be aware about. So CMS actually funds your residency slots. Okay. So the organization where you're training is already getting funding dollars for your training. Okay. So there are some rules about internal moonlighting versus external, because in CMS's mind, Center for Medicare and Medicaid Services, they're already getting paid, so they can't double dip in some instances. So I just wanted to mention payer rules and CMS, and I'm going to highlight that here in a minute. Okay. All right. So what I want to do now is, I should pause. If there's any questions, let me know, but I'm going to take a pretty big leap. Okay. I'm going to take the leap now that you've kind of narrowed down that funnel and you're saying, hey, I can get a state license. I'm not in violation of any rules. I understand what the medical staff where I'm looking at is required of me, and I think I can make it through their credentialing process. I think that was a question. If you are working somewhere, you have to go through their credentialing process. Okay. The credentialing process for a resident is very similar to that as a permanent staff member. You might not get full privileges, but you have to be an active provider. Okay. So I want to take a big leap now and say, hey, you found a place, you've cleared all those thresholds. Now, what do you need to look at? Okay. So if you're considering moonlighting opportunities, there's two different statuses that you could be in. Okay. First of all, you could be an employee. An employee is a W-2, just like through your residency training programs. You are a W-2 employee. They take taxes out of your check. You have a benefit plan. Okay. Some employers bring on moonlighters as employees. Okay. The other status is as an independent contractor, or a lot of people call them 1099s. That's the one I want to focus on so that you understand the distinction. Okay. If you are moonlighting as an independent contractor, it means you are not employed. You're not going to get a W-2, and essentially you're functioning as the employer and the employee. I'll answer your question in just a second. So you're, as an independent contractor, you're functioning as the employer and the employee. So is that a good thing or a bad thing? Well, it's neither here nor there, but you've got to understand what being an independent contractor means. It means they're not taking taxes out of your paycheck. So that means if you're earning a fair amount of money moonlighting, you should probably be filing quarterly income taxes with the government, because at the end of the year, if you didn't pay in, you're probably going to get stuck paying a pretty big tax bill at tax time. Or two, if it's a significant amount, you could essentially get a penalty. Okay. Now, what are some of the pros of being an independent contractor? As an independent contractor, Oftentimes you can track your expenses. So maybe you can track mileage. Maybe you can deduct the cost of your licensure, your DEA license, anything that you bought in order to be able to be a moonlighter. So you're basically your own little small business. You're an independent contractor. You can make income, but then you can deduct the expenses to kind of lower your tax burden. Okay. Now, there's other things that you need to think of as well if you're going to be an employer or an independent contractor. And the next thing you need to consider is what other benefits are there? Okay. To me, one of the big things you need to be really paying attention to is who's covering the malpractice. Okay. If you are moonlighting outside of your training institution, you're going to have to make sure that you have malpractice insurance that covers those activities. Okay. So you need to understand if they're providing it. Well, if they're providing it, you need to understand what kind of insurance it is. There's 3 types of malpractice insurance: occurrence-based, claims-made, and modified claims-made insurance. Occurrence-based is the best insurance. Why is it the best? Because it covers claims based on when the alleged claim occurred, not when the claim was made. So with occurrence-based malpractice, you don't need tail coverage. Okay, here's another way to look at it. If you work for an employer or you moonlight for an employer as an employee and they have occurrence-based malpractice and you moonlight for 2 years and then you leave and you move across the country to take your permanent position and somebody files a claim after you leave, but it's for something that occurred when you were moonlighting and it's something that occurred when they had occurrence-based, you don't need claims, you don't need tail coverage. Okay. Because the coverage is based on when it occurred, not when the claim was made. Now, the second type of malpractice is called claims-made insurance. It's just the opposite. Whatever insurance you have when the claim is made is what covers you. So same scenario, you moonlight for 2 years. You leave, move across the country, take your permanent position, and after you leave, somebody brings up a claim. Whatever insurance you have when that claim is made is what covers you. So if you have claims-made insurance and you leave, what you need to do is you need to have tail coverage, or sometimes it's called extended reporting endorsement, that covers you from the time you leave, covers everything that you did before you left, but it covers you from the time you leave through the statute of limitations. So as long as someone can sue you. So here in Michigan, we have predominantly a 2-year statute of limitations. Okay, so you buy tail coverage, covers up all this for as long as somebody can sue you. So if you are considering moonlighting and you have occurrence-based, I don't need to worry about tail coverage, right? But if you have claims-made insurance, you need to now say, thanks for the claims-made insurance, but who's paying for the tail coverage? Because if you finish moonlighting, you're going to have some sort of policy that covers you until the tail runs out. Okay. Third type of insurance is called modified claims-made insurance. It's kind of a hybrid of both of them, but from a coverage standpoint, it's the equivalent of claims-made. Basically, it's where an employer has claims-made insurance, but they modified it by pre-buying the tail. So essentially, there's 2 policies, but you're covered. Okay. So back to employment versus independent contractor. You can be employed and they could cover your malpractice. You could be employed and they could cover claims made, but they still could put the burden on you for tail coverage. You could be an independent contractor, and as an independent contractor, they could say, hey, we're not going to pay your taxes. You're a 1099, but we are going to provide your malpractice. You want to know what kind it is. Okay, so your status as an employee or an independent contract really doesn't impact who's providing the coverage and what type of coverage it is. Okay, so I'm going to tell you a quick story. I was working with a hospital in Northern Michigan, and we were hiring a family medicine physician. He didn't really bring it up during the recruitment process, but he did some moonlighting in an urgent care, short stint, about 9 months, was trying to make a little extra money. Okay, where we found out about it is when he applied for medical staff privileges. You have to divulge all that. Well, anytime you apply for medical staff privileges, what they want to know is your malpractice history. They want to know that you were covered. So it was the first time that he actually found out he didn't have malpractice. And because we were still within the 2 years of the statute of limitations, he still could be sued. even though we were hiring him and he was applying for medical staff privileges, he had to go out and buy his tail policy. Thankfully, he only worked for 9 months. Thankfully, he only worked a few shifts. I think it was just under $1,000. But the point is he didn't even think of it when he took the moonlighting job. Whoever he was moonlighting for didn't think to tell him. He didn't think to ask. He wasn't covered. And now his future employer was asking for the documentation of, hey, you did this. Show us you're covered because we don't want it to come back and haunt us. Okay. All right. I'll pause for just a second. It looks like there's at least a couple of questions in the chat, and then I'll go back to the other points here. I am wondering if ACGME or CMS have any rules for the private funding programs that only pay 36 to 38K salary for PGY, and they do not allow moonlighting. Do you have any recommendations? So I guess I don't know this answer off the top of my head, but my first question is your program ACGME accredited? Because if it's not an ACGME program, you're not going to have to follow their rules. Okay. I could do a little bit of research if you wanted to email me directly to find out the answer, but honestly, I don't know it off the top of my head. Any recommendation on how to proceed would be to research it and let's find out the answer to that. My gut's probably telling me that ACGME still has rules. CMS probably cares a little bit less because they're not fully funding your slot, but I would have to research that to be sure.
So all residencies are ACGM accredited. And so if you're at a program that is funded privately rather than through CMS, only a portion of your funding, to my understanding, is private. A good portion of it still comes from CMS, but not allowing moonlighting, again, is kind of their prerogative. If you're asking for like financial tips, we can talk offline. I had a couple of programs and friends at like in the New England area that struggle with finances a bit more than I do in the Midwest. But if you have a different question is in terms of like how to proceed, please clarify.
And I would say too, I know that all residency programs are ACGME accredited, but I do think there's some fellowships that maybe aren't. I have some experience with maybe some super subspecialty fellowships that aren't. And my guess is there are just maybe some different rules on those. Okay. Can you speak a little bit more about moonlighting in your own facility? If I'm in a university affiliated hospital, I get my check from the university. Can I work at the hospital? Great question, Dr. Youssef. And yes, I can answer. I think actually my last slide is going to talk about specific moonlighting opportunities internally and externally. And you're onto something with that. Okay. All right. I'm going to finish these and then we'll go on to those specific questions that Dr. Youssef had. Okay. So the other contractual considerations that you need to consider when you're looking at moonlighting is if you're applying for your state licensure, if they're requiring you to get a full DEA and all of that, those are costs that you're going to have to bear. And I think there was a question that said, hey, can I lose a benefit through my training program? The answer is no. You're still going to have your training program benefits. You're still going to have your ability to keep your educational limited license. But what you're doing is you're choosing to get other things and those costs you're going to have. So what you're going to want to know is, as a moonlighter, are you going to have to pay those out of your pocket? Or is the organization, institution, company going to reimburse you? Or if they're not hiring you as an employee and you're going to be an independent contractor, then you could write those expenses off. But I want you to consider it because DEA expense, Dr. Howerton can probably tell you, I think they're upwards of $900 to get a DEA license right now. I just looked at the state of Michigan recently, and I think between the state of Michigan and the board pharmacy is like $360. So you're investing, $1,200, $1,300 to get your permanent licenses so you can moonlight. So you're going to want to be doing some of the math to saying, hey, if I'm making a $1,300 investment, how much am I going to have to moonlight before I'm even in the black? Okay. Next thing you want to do is, and this was a question, and I will tell you, I had to do a little research on this, and I'm hoping Dr. Howerton can comment on this as well. But one of the questions that came in ahead of the webinar was, if you're making extra money from moonlighting, could that impact your student loan payments if you're on income-based repayment? And the answer is yes, from what I could tell. What I understand is they don't just take your word for it of how much you're earning. I think what they do is you actually have to reapply to go into the pot that's going to say, where do they fall on this income to actually determine the payment. It's going to take a little bit to catch up with you. That's why I think a lot of folks are encouraged to apply for income-based repayment when you are you're only an intern for half the year, right? Your first year, you're only getting half your income, so your payments can go lower. It takes a whole year to catch up with it. That's going to be the same thing with the income-based repayment. If you're moonlighting, it's going to take a year to catch up with it because you're going to be earning all year and then probably have to report it based on your tax documents. Okay. And then the last thing I do want you to consider is if you're signing a moonlighting agreement, and I will tell you, I know employers that have very simple moonlighting agreements. I know employers that have hardly any. It's just, hey, you're getting hired, you don't even sign much. And I know employers that say, hey, if you want to be a moonlighter, you have to sign kind of what looks like a regular agreement that could be 20, 30 pages long. And even though you're PRN or contingent, moonlighter, adjunct, whatever you want to call it, you want to drill down and you want to make sure that you understand the risks. And when I look at the risks, I put one on the bottom of your screen here right now, non-compete clauses. I look at 5 common risks with employment. Okay. The first is variable income. So as a moonlighter, my guess is all of your income is going to be variable because you're going to get paid for shifts that you work or days that you work or a service that you provide. So all of your income is going to be variable. Okay. The second risk I feel like you need to look at is termination. You want to understand what are your obligations or options if you want to get out of that deal. Do you have to give them a 90-day notice? Do you have to give them a 30-day notice? Same thing, they usually have the right to terminate you. So you want to know if you're moonlighting, is this something that they can say, hey, we're done today? Or do they have to give you 90 days notice so you can try to line up another gig? Okay. Third one is non-compete clauses, and I put that down. Okay. I would think for the most part, as a moonlighter, there wouldn't be a non-compete clause, but believe it or not, I've read them. I've read moonlighting agreements that say, hey, if you want to work for urgent care for us, that's fine, but you can't work for any other urgent care in a 10-mile radius from us, right? They're getting selfish. You might have to sign a non-compete. That's a whole controversial story because the Federal Trade Commission is trying to ban them, right? But there's like a 510-page document that I've sifted through, and there's certain employers or certain institutions it won't apply to. Okay, like nonprofits, I think, are going to be excluded from that. Okay, so variable income, non-compete, termination, and the next one is repayment, which you shouldn't have any repayment, but I'm going to bring it up. If whoever you're moonlighting for agreed to pay for your DEA license, they might put their hooks in you and say, hey, you have to moonlight for us for a year, and if not, you got to pay us that back. Okay. And then the last one is malpractice. Those are the 5 main risk areas that you should be looking at in any type of agreement, employed or independent contractor. What you want to do for the most part is understand the risk. Second thing you want to do is try to minimize the risk as much as possible if you're able to negotiate it all. And if not, what you need to do is say, I understand the risk and I'm willing to take it. For example, I understand I'm going to have to buy my own tail coverage. I understand there's a non-compete clause. I understand I have to give a 90-day notice. Okay. All right. Anything, Dr. Howerton, anything you want to add on contractual considerations? I don't know if you're, familiar with anybody that's moonlighting that's had to sign an agreement that had other strings attached or had other kind of key factors that they needed to be looking at.
The non-compete clauses always seem to be sneaky in there. Luckily for us, the groups that our program is historically associated with is very well appreciative of new residents moonlighting. And so we don't have non-compete clauses, but I do know as you're looking for other jobs and things like that, it's a big deal. So that is probably like the biggest thing. Also, definitely the additional compensation changes your repay plan. I talk about this later in some of the other questions, but it's a significant money maker. And so your total salary is significantly changed, or rather can be significantly changed. So I would say be prepared to pay back some of that more so than you would if you were just on a PGY salary.
Perfect. All right. Well, I'm going to talk now a little bit, and this hopefully will talk a little bit about Dr. Yusuf's questions. So when I look at potential moonlighting opportunities, I kind of pulled this from my knowledge of some internal policies and my experience of working for hospitals, for health systems, and for employers that employ moonlighters. Okay. So the first thing you could do is you could pursue non-clinical work. Okay. Non-clinical work is still moonlighting, right? Because if it's not part of your training program and you're doing it and you're getting paid for it, it is part of this. So you could look into moonlighting and doing some research. Somebody asked the question about tutoring. Yes, that's considered moonlighting. You could be an Epic super user. Those are all things that you could do outside of your training program and get paid for. Okay. Next thing you could do is you could get paid or pursue opportunities to work within your institution and do things that are not part of your curriculum, but you're getting paid extra to do it. For example, if you have a 55-hour work week and you've kind of met all of your expectations and you've met all of your requirements, you could actually pick up extra shifts. So I'm going to speak about where I work right now with Pine Rest. Our residents and fellows are allowed to do weekend rounding on the inpatient units. Those are called paid learning experiences because it's not a requirement of training. It's not an expectation. So CMS technically can't get upset because they're not giving us money so that you could do this. This is above and beyond your requirements. So we call those paid learning experiences. Okay. Extra pay for extra shifts. If you have so many shifts that are required during a rotation or during your curriculum and if you're exceeding them, you could get paid for them and it could be fine. Okay. Now there's also internal moonlighting that's not required to be part of your training. Okay. I had this example happen recently where a fellow was moonlighting as an adult psychiatrist. So they did their 4 years of adult psychiatry and they were certified, they were eligible, they had the full state license going on for a forensics fellowship. Well, we didn't require forensic fellowships to again cover some of these shifts in the hospital, taking care of the inpatients. So he was able to pick up shifts and get paid for that. Another example would be if you're in an institution and you are, I think someone put neurology, and I'm a little less familiar with that one, but we have a lot of specialists. I had an orthopedic surgeon that was covering an urgent care. Okay, so those are ways that you can work internally, doing work that's not required as part of your training, but it's with your institution, right? Which would be a good thing, probably looks really good. And chances are you're going to be covered under their umbrella malpractice policy. So that's probably going to take one thing off your things to worry about. And then there's external moonlighting. And again, that might be where, for instance, you're in a hospital and you're working for that hospital and you're going through training there, but you pursue an outside urgent care opportunity. Here's another example at Pine Rest, what we do. We actually hire third-year internal medicine residents and third and fourth year med peds physicians to come to Pine Rest and moonlight on our general medical team to do H&Ps on our inpatients upon admission and round on psychiatric patients for their medical concerns. So that's an example of us hiring a Corewell, for example, Corewell resident to come to our institution and moonlight as an outsider. So what do we require? We require that they have their full state licensure. Okay. We require that they have their training programs, they have to disclose it and have to have their authorization. Okay. And then they can come in and moonlight, or we call them adjunct providers at our facility, and they get paid. As an adjunct provider, you are employed at Pine Rest and we cover your malpractice. So from a moonlighter coming into Pine Rest, it's kind of an easy thing. You do have the added income. And could that affect your loan payments? Sure. But you don't have to worry about all those other things in regards to malpractice and tail coverage and whatnot. It's pretty, and you don't have to worry about paying taxes because we cut you a paycheck. Okay, so I'm going to try to address Dr. Yusuf's question right now because I thought it was a very thoughtful question. So training at an university affiliated hospital. Gets his check from the university. Can he work in the hospital as a moonlighter independent contractor? And I would say it depends, but I'm going to give you an example, Dr. Yusuf, that I think is directly applicable here. Okay. You work at a hospital, regardless of who your employer is, but you have a radiology department that is run by the university. So the radiology department is not employed by your hospital and they need kind of medical clearance or medical surveillance doing MRIs. You can do that. It's a whole different employer. Excuse me, as long as your program allows it. Okay. But CMS doesn't mind there because you're getting paid by somebody differently. So I'm going to go out on a limb and say if you're working for a university hospital and you're getting your check from them and you want to moonlight and work for the hospital, I think you're going to be fine. Okay. All right. Were there three? Let's see if there's other. Okay. Other questions that we have here. Is it getting common that many urgent care or hospitals don't hire physicians without board for moonlighting? I have noticed that a lot in Georgia. When you see, meaning you're not board certified? Is that what you mean, Faraz? Yes. Okay. You know what? I can't speak to whether it's the board certification, but I will tell you my observation is, and you guys aren't going to like to hear this. I think APPs are taking a lot of your moonlighting opportunities away because instead of hiring you as a moonlighting resident or fellow, they can hire APPs or get APPs to moonlight and save them money. So I really don't know that it's a board certification requirement. I haven't seen that so much. Have you, Dr. Howerton?
No, but I'm also in Michigan, and the Midwest is typically more friendly towards uh like trainees rather than APPs. I think when you get further south and towards kind of the periphery of the country, you tend to see more like advanced practice practitioners. Typically though, they want you to be board board certified and board eligible are different things. You oftentimes only have to be board eligible, which means that you've passed level 3 and or step 3, depending on your pathway, and that you're still progressing through residency in a timely fashion. So it may say board eligible or board certified. Board certified, obviously, none of us are going to be that quite yet, but board eligible, all of us continue to be able to do that.
Yeah, and just Fraz, to kind of expand on that as well, let me tell you, when you look for your permanent position, you don't, you oftentimes you don't have to be board certified to even start your permanent position. Like Dr. Howerton said, is oftentimes when you graduate, you're board eligible and they allow you a certain amount of years past graduation to become board certified. So I really do doubt that they need you to be board certified, but I 100% agree with her that the board eligibility could be a threshold for some employers. Yep. Boarded in what or just finished step 3, level 3? I think you guys answered that, so that's good. Thank you. They told me the pay or don't pay the same for not board certified physicians. That's interesting.
That I can say is typically true. Like a resident is never paid to the same extent as an attending in my experience.
And
So
I have a little bit different experience on that, only because, again, I'm looking at some of these specialties where you're coming out and you have to do 200 surgeries before you can become board certified. Oftentimes there's a period of time between graduation and becoming board certified. And we still bill and we still collect on the same thing. You know, I'm thinking of even in psychiatry, you might start working in July and you don't take your boards until September. You might be a child and adolescent psychiatrist and you're board certified in adult, but you haven't taken your child board yet. We still get paid the same amount. So I can tell you in psychiatry, that's not the case. You know, getting paid as a resident may be different than an attending, but I don't think it's a board eligible, board certified thing.
I would say
Good
that's probably
questions.
true.
Great questions, actually. So I'm going to pause. That's what I had prepared. I don't know. I think we covered a lot of the questions, but I think Dr. Howerton may be tracking some of the other questions that she wanted to comment on as well.
I do. I will start answering some of the ones that were pre-populated to us, but please feel free to insert any of them into the Q&A button so that it pops up differently for us. So if you could put it into the Q&A, that would be great. The first question that I see is, are there circumstances in which you would not recommend residence moonlighting? And I would say absolutely yes. If you are in a specialty that hits you close to the 80 hours at baseline, it's probably not in your or the patient's best interest that you're pushing that 80 to 90 hours at any given time. In case you didn't know, if you're a med student and not necessarily resident, those 80-hour work weeks are based on averages. And so if you're averaging close to that consistently, I would not necessarily recommend moonlighting because your wellness probably matters more. But typically, I think in a lot of primary care or hospital-based medical specialties, not necessarily surgical, but medical, there's tons of opportunities for moonlighting. The next one is about balancing reading on your patients, composing the perfect note, being a slow typist, preparing for in-service exams, and step 3 to moonlight. I will say it's probably part of the reason why you don't get to do it as a first year, because that is super challenging. To kind of learn what your flow looks like and what the department looks like and what your hospital system flow is. As far as composing good notes, learn what are the billable pieces of your note and focus on those. And then secondarily, like what helps with patient care, those kind of two things can make you have the perfect note without it being a novel. Slow typing, use Dragon or whatever voice to text model that your hospital utilizes. I will preach this from the mountaintops. I don't type hardly at all. I see too many patients and write too many notes to give myself carpal tunnel at such a young age. Preparing for in-service exams, I would say ask your seniors. Most programs provide some level of like Q banks or study materials. There's usually like some Google Drive of goodies from your program that's been passed down for reviews and things like that. So kind of lean on your program, lean on your seniors to help kind of prepare for that. I started mostly paying attention in November for my in-service in February and worked out for me. Step 3, level 3 studying. I did the same at the same time as studying for in-service. I'm currently studying for level 3. I just do questions and review the content I don't remember. It's good to remember that you have already learned essentially all of the material on it. So it's just kind of reviewing and keeping it in your brain, which sometimes is easier said than done. The next one I see in the chat says, how do you get started on moonlighting? Any websites or people to contact? And are we allowed to moonlight in other states outside of the state you're doing residency in? Yes. As far as getting started, my first recommendation is to go to your program director, your program coordinator, the left and right sides of the brain of the program. They can kind of help guide you as to what the policies are at your hospital, at your program, in your state, and kind of get you set up for success, kind of like Susan was talking about. You can't really do this on your own. You need kind of a lot of help in order to get you there to make sure you're doing it legally, safely, and kind of protecting yourself as well as protecting your patients. As far as like websites or people to contact, the seniors in your program.
I was just going to say that that's a great suggestion. And I actually have another suggestion too. I think you should reach out. I know this sounds silly because, you're pretty early in training. Get to know your physician recruiters at your institution and organization, because they recruit for permanent, they recruit for locums, they recruit for moonlighters. And if they know you're interested, sometimes they'll go dig up some opportunities for you. So I would get to know the physician recruiter at your organization, because they're going to be aware of where the needs are. And then this is a very unrelated suggestion, or topic. Should you moonlight? Should you not moonlight? I have to leave that up to you and all the things that Dr. Howerton said you should consider. But I'm going to tell you, when you're applying for permanent positions, moonlighting kind of shines on your resume, on your CV. So, don't do it and force yourself to do it. But my point is if you do moonlight, keep track of all that, because you're going to want to include it on your CV. So when you start your job search, when you're transitioning into practice for the first time permanently, you're going to want to include all that detail. I am not familiar with any websites that are specific to moonlighting. You could go to some of the big job boards like Practice Link or Practice Match, but those are going to be more geared toward permanent positions. I would not recommend that you register on those websites, saying that you're interested in moonlighting. Instead, I would look at jobs and maybe type in some of the keyword searches like moonlighting, temporary locums, and see if they have any positions available. The other thing I would do is, in addition to working with your home institution, contact the surrounding health systems. Again, I'm in Grand Rapids for Pine Rest, and we have, there's just a few health systems there. So it's not unusual for residents from one to moonlight through another system.
I love all of those suggestions. And maybe in the next like 2 hours, I would have come up with them, but not on the spot like that. So thank you so much. Moonlighting in other states, as far as I know, as long as you have a full license, it's fine.
That's my
Susan, you might
understanding as
know.
well. I think as long as you look at the funnel, state licensure, your ACGME, the medical staff requirements, I don't know of any restriction about crossing state lines.
The next question I see in our predetermined list was how to plan for moonlighting as an FM resident and what is a reasonable earning from moonlighting. That is totally up to you, your program, and how your schedule works. I know that for our program and the partners we have for moonlighting, if you moonlight an additional 4 shifts a month, you get an additional paycheck every 4 shifts you work. So you could end up with potentially a lot of money or not, it all depends on what rotations you're on and what kind of hour requirements your hospital and your program requires. But that is what works at our institution.
I have a couple of other things that just kind of were coming to mind as far as moonlighting opportunities. I'm thinking some of the physicians that I've worked with in the past that have moonlighted. One comes to mind. He was an orthopedic surgery resident training in Southeast Michigan. And we have some very large concert venues, Palace of Auburn Hills, Pine Knob, all of which have medical tents or medical offices. And he used to moonlight in, like, on the night of a concert or a night of a big show, because if somebody passes out or someone's dehydrated, they get carted off to this medical tent or whatnot. And that's how he moonlighted. And he got paid well for it too. So that's another opportunity that I can think of. So don't just think urgent cares, think of other places they have medical providers. Made me also realize that you have to be careful if you're volunteering. I'll give an example with one of the Trinity hospitals I've worked with. Some of their residents wanted to volunteer to be in the medical tent at like a marathon or a half marathon. That was volunteering, but the residency program told them, no, you cannot do that because that puts you at risk. We're not covering your malpractice, and neither are there as a volunteer, and they felt like that could put them at risk. So they told their residents they could not volunteer to do that type of activity.
Our program is like that too. You have to be volunteering health related with the hospital institution in order for that to work out the way it's supposed to.
Right.
One of the questions in the chat is the whatever that's called, interstate medical licensure contract or compact or whatever. Maybe it would be worthwhile if you planned to regularly practice in more than one state. Here in Michigan, I don't have that problem. I am pretty landlocked. But I suppose if it worked out for you the way that it would, that'd be more of an individualized basis.
And I think there is value to doing it, just because once you have it, it's if they're a state that recognizes it, it just basically expedites the process. But I do think there's some additional cost to it too. So you might want to look at the cost as well and say, is it worth it?
That is also my understanding.
Yeah.
The next question that we have from the predetermined list was best practices in tracking or managing moonlighting for both resident and patient safety. So at our program, if you choose to moonlight, you have to track every shift that you work in our tracking system. So typically, because emergency medicine is not one of those that routinely goes over or even anywhere near the 80-hour work week, we have predetermined months that we track our hours. If you choose to moonlight, you voluntarily have to report every month. So you moonlight and it color codes your program shifts, your didactics, conference, and then your moonlighting shifts. And so it will automatically track for both you and your program, and then your sponsoring institution can always keep track of what you're doing and how many hours. Our program also lets you export that information. So like Susan was talking about, when you're ready to get your first permanent job, you already have a documented list of how many hours and which urgent care or hospital or whatever that you were moonlighting at. It's auto-populated into an exportable file for you, which I think is really nice.
And I don't know that 100% of programs have that, but I think this has been such an issue that many programs have invested in some sort of, even if it's not sophisticated, tracking system for you to do that. Again, going back to some of the comments that I was reading online today, it was almost like a dismissal, like, hey, you can make way more than, moonlighting, and who cares? Don't risk it. Log it, keep track of it, report it, disclose it. Someone will find out about it. Whether it's CMS, whether it's the ACGME, whether it's your program, whether it's the future employer, when you go to apply for a job and you're like, oops, I didn't get malpractice. It's just not worth it. So cover all your bases up front.
The next question that I see is about typical moonlighting hours and how to manage your time. So I talked to a couple of our second years. As I said earlier, I'm a first year, so I'm not currently moonlighting, but I am in the process of filling out all the paperwork to moonlight come July 1st when I'm a second year. So I kind of know somewhat of what I plan to do. When I'm in the department in the ER, we work 18 shifts a month, which gives us honestly tons of time to moonlight. So my hope is to start out with 2 shifts a month and work my way up to 4, 6 extra shifts a month. I'm not putting pressure on myself, kind of talking about both resident and patient safety, kind of prioritizing mental health, making sure that I have the time to also learn outside of shift, to make sure that my patients are always getting the best from me. But our hospital system partners that we use, so at our hospital, we have, just like Susan talked about, all 3 different kinds of moonlighting. We also offer all 3 different types of moonlighting and partnerships with each of them. So there are routine, what we call house shifts, which are the internal ones. extra shifts, which are the extra shifts. And then our external ones are at different urgent care partners that we have. And we have an entire document on kind of like fast facts and things that our hospital uses to make sure that we don't get ourselves into trouble, which is really helpful and has been very important to kind of help organize kind of how I think my next year is going to go. But we have 4, 6, 8, 10, and 12-hour opportunities. So that is what the time opportunity, I have a like typical hours. Most of our residents work the 6 or 8s on their days off so that they can sleep in and get home before dinner.
And Dr. Howerton's talking specifically about being an emergency medicine resident and shift worker. I have a lot more experience working with maybe primary care residents who have obligations Monday through Friday, or maybe they're on nights. The hours for those type of moonlighting and work opportunities, I've seen them pick up night shifts, evening shifts, like a 6 to 10 in an urgent care, or a Saturday, even 12 hours. To my experiences, the vast majority of the moonlighting opportunities are in just a couple of spaces, one being urgent care, the second one being some sort of inpatient rounding hospitalist type work. And then there's those ones on the peripheral that are not necessarily you're doing straight up clinical care, but you're doing more surveillance, clearance, and those types of things. But I find that most of the opportunities where we've hired, in not just my current role and past roles, really surround urgent care and more of the inpatient shift work.
The last question I have before we go is, what are the tasks for residents during moonlighting? So on our internal shifts, those are what we call house shifts. So you respond to like the rapids and the code blues, and you admit to the house doc. So that is kind of like your minimum requirements there. You can also do extra shifts. So that's kind of, some programs have Jeopardy. We do not have Jeopardy. So if somebody calls in and you want to pick it up, you can. There's a couple of strategically placed times off in our hospital that kind of are always filled, or preferentially filled, I guess, by moonlighting. So our internal medicine and family medicine residents only work Monday through Friday, and then they cover moonlighting shifts on the weekends. And then if nobody picks it up, then the intern has to come in. But most of the time, people would rather come in for the morning shifts to round on patients for the significant boost in pay. And then for urgent cares, it's kind of like my normal triaging time. It doesn't feel honestly any different than being in the department. Just a lot less resources. So you kind of learn what you can and can't manage in an outpatient setting, or kind of an in-between setting, which is kind of nice for me. And I would think is helpful for a lot of other people as well. Kind of just learning what resources are available. But
I'll give a couple of examples too, regarding pay. I think someone was asking questions about pay. It varies greatly. It's going to depend upon the role, the responsibility, and the shifts. But I'll just give a couple of recent examples of one was a primary care physician working in an urgent care. It was paid hourly. The rate that I've seen for that, I mean, it can vary greatly, but I saw 95 to 110 an hour for urgent care shifts. And then if you're doing more of the inpatient rounding, like we have the internal medicine or the med peds physicians, they tend to round in shifts. So we just pay a shift pay. And I think for a 6-hour shift of rounding, they come in the hospital and they work about 6 shifts, 6 hours, it's $600. So I'm finding it around the $100 mark.
that is also roughly about what happens for us too. Alrighty. Well, thank you to the panelists for this great discussion, and to all who joined us. As a reminder, the recording of this session will be posted to the AOGME website within 7 days. If you have questions, please contact us directly at AOGME@acom.org. This concludes our session.